appreciate about the Department of Family Science is the multidisciplinary nature of my department. So everyone comes from a different perspective, and that makes our discussions really rich and meaningful in the way we all think about families and how we can use families to address health disparities.
Individuals are nested within family, and then it's these families that create a nation. So if we want to improve the population health, we need to start from families.
Is at its core a very applied science, an emphasis on social justice, health equity, that really speaks to, I think, a lot of students and their experiences, both within their families, but also as young people. And so I think they tend to understand that family science is not just about any one person and their experience and their mental health, but how that plays out in their families, how their families experience mental health concerns and other social issues, and then their ability to address those from a family perspective.
I feel my research in the area of maternal and child health, but also refugees and all that, is something that can make real impact in communities.
The research that we do is very community engaging. We don't go in and tell them like this is what you need to do. We like to work with the people that we are serving in the capacity that we will ask for their feedback, or we will be directly involved with them.
We've been working on a project called Encuentros, which is the Spanish word for coming together. Encuentros is what we call a psychoeducational intervention. It came about during COVID when our partners at Identity very quickly realized that the pandemic was having a disproportionate effect on the Latino immigrant community. We started with an intervention primarily with mothers, and have since expanded to fathers and most recently to adolescents.
The Center for Healthy Families is a training clinic associated with the Masters of Couple and Family Therapy program in our Family Science department. We have several of our first and second year students who are providing therapy as a part of their internship experience in the center to the many different people across the UMD campus and surrounding areas.
I run a research group that's called the Sex Orientation, Gender Identity and Health, or SOGI Health Lab, and we convene around a variety of projects that are really interested in understanding and addressing mental and behavioral health for LGBTQ plus young people, and how their experiences in their families, in their communities, and in their schools shape their health and wellness across the life course.
We know that stress and trauma have a wealth of health impacts, and it stretches pretty broadly, and it impacts people in many ways. And so my work really is about partnering with communities to address those issues and help families and youth cope better with things like community violence.
I do a lot of work around masculinities and working with men and families. So whether it's working with incarcerated fathers who are returning back to the communities, with youth development, youth in transition to adulthood who are looking for education and jobs, it's kind of finding that right community partner to work with and building that trust and rapport.
We are addressing some of the most pressing public health issues of our time. So it's just a really exciting place to do work that has public health relevance, that is addressing health inequities, and is really putting public health into practice in ways that I think really has meaningful implications for the communities that we work with.